Today we will be performing a patient examination. When performing a patient examination, we must include 3 things: history, review of systems, and tests and measures. Within the history, we must ask about disease, injuries, surgeries, family history, medications, etc. Within the review of systems, it's more important to focus on the nature of the pain or any referred pain. And then in the tests and measures today, specifically, we will be focused on heart auscultations and lung auscultations. And lastly, ankle brachial index. Before we begin, we want to make sure that we wash our hands. Rub it in until the alcohol dries. Hi, my name is Thalia. I'm going to be your student physical therapist for today. We're going to start out, I'm going to ask you a couple questions just to get a little bit of history, and then we're going to move on to some tests just to test your heart sounds and lung sounds, okay?
Sounds good.
Okay. Start out by saying your name and date of birth for me, please.
Paulo Illigan, June 23, 1995.
All right, Paolo, and what brings you into therapy today?
The doctor said I have tennis elbow.
Uh-oh. Okay, so we're going to look at a little bit more into that. How did those symptoms begin?
I would assume while I was playing tennis is when it began, because I was playing one weekend and it started hurting. The next day it was still hurting.
Okay, and how long ago was that?
About 3 months.
All right, and are you in pain right now?
A little bit.
Okay, so on a scale of 0 to 10, 0 being little to no pain, 10 being extreme emergency room pain, where would you say you're at right now?
About a 3.
About a 3? And what's the worst it's been in the past 24 hours on that scale?
Just 5.
About a 5, and then what about the best it's been?
Maybe a 2.
Okay. And how would you describe that pain?
It's kind of dull and sharp.
Okay.
You know.
And is there anything that makes it worse?
Yeah, when I
Okay,
when I,
that movement right there?
Yeah,
okay, you don't have to show me.
movement.
It's kind of
Okay.
this movement right here?
Yeah.
Okay. And is there anything that helps?
Just resting it and icing it.
Okay, and usually when it does get a little bit worse, how long does it take to get back to baseline?
Maybe 30 minutes or so.
About 30
with
minutes?
the rest and ice, yeah.
Okay. And then overall, have your symptoms gotten any better, worse, or have they stayed
About the same.
About the same? All right. And are you seeing any other healthcare providers for this?
Just my physician.
Just the physician, and he
Yeah.
referred you here?
Yep.
Okay, perfect. And this pain, is it mainly located in the elbow, or is it referred to other areas of the body?
Mainly just the elbow.
Okay, and just to clarify, it is the right arm, correct?
Yes, this one.
All right. And have you had any related surgeries or injuries?
Nothing related to this.
Okay. All right. And are you taking any medications for it?
No. Just some Advil.
Okay. And about how much do you usually take? with it?
Usually 200 milligrams, like every morning
Every
or
day?
so, and it'll usually just.
Okay, so
help
just
me.
in the morning.
Yeah, just in the morning.
Okay. And have you had to increase that dosage at all?
No.
All
No, I
right.
just kept with the 200.
And any side effects with it, even though it's just Advil? Okay.
No, nothing.
Your physician knows about it or no?
Yeah.
Okay. Do you have a family history of hypertension, diabetes,
Mm-hmm.
heart disease, cancer, stroke, any of the above?
Nope.
No? All right. And then what about your environment? So at home or when you go out, does your environment limit you at all with that injury?
Just really opening doors and anything where I have to do that kind of.
Kind of reach and
That-
grab?
Yeah,
Okay.
that kind of motion.
Okay. Do you have a lot of doors in your home, or can you mainly leave them open?
Just the one to the bathroom and my food.
Okay. All right, and you can use the left arm to open those?
Yeah.
Okay. So what about work? Do you work?
No.
Okay, and what sorts of hobbies do you do?
Sports, I'll play tennis, golf, basketball, soccer, lots of sports. I shoot guns, race cars, motorcycles.
Okay.
Just a lot of
And
things.
so how does your elbow affect all of that?
Can't really do much of those. A lot of, like for the bike, for example, when I kind of do, that kind of,
Yeah, that
the throttle,
kinda
it hurts.
makes it hurt. Okay.
Anything else. A lot of sports will have that same kind of pain when I'm
Right.
moving around, so.
Okay. And then overall, what are you hoping to achieve in therapy?
Hopefully to get rid of this pain so I can start doing stuff again.
Yeah, so you can start getting back to those sports.
Yeah.
All right, perfect. Well, thank you so much for your time, Paolo, and let's do a couple tests just to see where you're at with your heart and lung sounds and blood pressure. All right, so we're gonna go ahead and take your ankle brachial index. Essentially, I'm gonna take pulses on your right and left arms as well as your right and left ankles, okay? So we're gonna start on the arm. Go ahead and lift up the arm for me. And we're gonna roll up this sleeve just a little bit. All right. Before we take the ankle brachial index and the arm, I want to make sure that I find the brachial pulse. So that's what I'm doing now. All right, and I'm just going to put a little bit of gel on your arm here. All right. Same thing on the other side. We're gonna do the same thing on the right arm, so go ahead and lift that up for me and relax. Okay. And a little gel on this side. We're just going to do the same thing on both ankles. Alright, so I'm going to have you remove your socks. Alright, before we find the ankle brachial index of the ankle, we need to find the posterior tibial pulse. So that's what I have here. Ankle. And we're going to line that up with the artery there. Okay. You're going to find your posterior tibial pulse, so that's the pulse behind your ankle. Last time on your left ankle. So far, so good? All right, now we're gonna do your left ankle. Go ahead and lift up the leg. And again, right behind that medial malleolus. order to calculate the ankle-brachial index, for the right foot, we need the highest pressure in the right foot over the highest pressure in both arms, which we found 128 in both arms. In the right foot, we found 148. So the right ABI would be 148 divided by 128, and it would give you 1.16. Then the same thing in the left ankle brachial index, except we take the highest pressure in the left foot over the highest pressure in both arms. So the left ABI would be 140 over 128, which would give us 1.09. And overall, if we look at our interpretation chart, we can see that both interpretations are normal. Alright, so usually what we'll do is we'll take the bottom number of your ankles and divide it by the number that we find in your arms, and you are definitely above 1, so you are normal. Congratulations. So before we start taking the heart sounds of our patient, we want to explain the process a little bit more. We're going to be feeling for 4 spots, 2 in the second intercostal space and 2 in the fifth intercostal space. So we are going to have their shirt off. The sounds that we're actually looking for are the S1 or the lub sound and the S2, the dub sounds, the lub dub. So the S1 sounds, the lub sounds, are actually coming from the tricuspid and mitral valves, which are in the fifth intercostal space. Looking at the S2 or the dub sounds, that's what's coming from the aortic and pulmonic valves in the second intercostal space. We're going to find your heart auscultations, which there's going to be 4 spots, so I'm going to ask you to take off your shirt. And I'm going to find your second intercostal space. I need to find your clavicle. Alright, and once we start at the clavicle, we're going to feel down for the first rib, and then this is the second intercostal space right here. So we're going to listen for heart sounds right here. Sounds good. And same thing on the other side, same intercostal space. And now from the second intercostal space, we're going to go down to the fifth intercostal space and listen to the heart sounds there. And then if you could lift the tissue. Thank you. Sounds great. So very similar to heart auscultations, we should explain this process prior to actually performing the test on the patient. Make sure that they know what we're going to be doing. On the front, we have 7 spots that we're checking for the breath sounds. So we want to make sure that there's no abnormal sounds like crackling or wheezing. And on the back, we're actually going to have 10 spots that we're checking those breathing sounds. Alright, so now we're going to listen for the lung sounds. There's going to be 7. Alright, so just take a nice deep breath in and let it out whenever I place the stethoscope, okay? Perfect. How you doing so far?
Good.
All right, that's fine. We have 10 spots on the back, and we're going to start at the superior angle of the scapula. And we always want to make sure that our last point is right by the inferior angle of the scapula. And then at the end of our interaction with the patient, we want to make sure that we wash our hands once again.
I agree that Thalia has met all the skilled requirements in this video. My name's Paulo, and I approve this message.
Okay, so we're going to do the same thing on the left arm. Just kidding, it's the right arm.